So now let us hear from A.P.V. Reddy, Managing Director of Family Health Plan and Senior Advisor of Apollo Hospitals, Hyderabad. You have experience of working both in US as well as in India. Could you please give insights on how we should build strong network in India as well as in US? And also, is there any difference in networking in India versus US?
Basically, okay, talking about the Indian network, you have been there last time and then you saw us. It is limited to close groups, and I, knowing the power of the network that can happen, I have been trying to open up, especially the NIT group that we keep meeting pretty often, and introduce them to some of the other networks. Not been successful because the power of networking is not actually appreciated or known in India to that extent that what we try to do here. Simple example I can tell is that I have been able to get into this networking because I have been active in various alumni forums. Surprised that I was recently when I have been organizing the University of Wisconsin Alumni Association in Hyderabad. All we came to know was about 5 years ago that we were only 6 people, and 6 of us used to meet for a drink at a club, and then we recently we just put it back into the Alumni Association of the University of Wisconsin. Yes, that we are meeting. There was one gentleman by the name Kim Santiago. He said, "Hey, you guys, I know a lot of people. There are a lot of people from the University of Wisconsin in Hyderabad." And a professor who came in and he wanted some introduction to some professors in ISB, so we organized a dinner. And from that list, we found out that there were 72 people who were alumni of University of Wisconsin-Madison in Hyderabad. Believe me, we were stunned. We invited all of them, about 30-35 people came in from as far as Vizag and Vijayawada. And none of them knew that we were all there. And it is not that I was there in the university in 1971, and there was an undergrad who passed out in 2009. And he was stunned. He said, "So many people from my university." So then when we started talking, we found that they were in diverse professions, people running biotechnology units, one guy who was the managing director of Moschep, and I was in healthcare, and it was really a very, very interesting evening that we had, and now we keep in touch with each other, not through LinkedIn or anything, but through the University of Wisconsin website, because there is an alumni website that is there. So it is basically, the question is there in India, it is very close to groups. University, our own NIT Warangal alumni, we keep meeting. In that groups, we have people who meet just the years that we passed out. I passed out in 1970, so people from 68 to 72, we keep meeting. We have a drink together every weekend, and maybe with the families we meet every month. There are about 20, 25, 30 people. But then for some reason, these groups don't expand out into a larger groups. And last time when I was elected the president of NIT Warangal Alumni Association, and we had the Golden Jubilee, I had talked to the then director. He was a professor from NIT Suratkal, and an NIT Warangal professor is now the director of NIT Suratkal. So we met all of them and said, "Hey, why not we talk about a pan-NIT association or a movement so that we can all look at." It came up, and we thought that at Warangal we will take the lead in getting that particular. So I talked to the board of directors last month of Warangal, requested them to give us a space in REC Warangal and a secretariat from where we can sort of set up this, talk to different people. And it's so interesting that when I am here, I met people from so many different NITs that I think you can take this now forward and help me set up that pan-NIT association or whatever we call it. Of course, vested interest or selfishness, I would like it to be at Warangal, but it can be anywhere, doesn't matter. can take that forward. And I'm sure that people will realize that, again, network. In India, you still look at if you have a networking, hey, can this guy get me a job? But that will change slowly, I'm sure. It's not that jobs are not the only things that people can help out with. People can help out with so many other things. And especially where I could help out recently, my friends and everything, is the minute they knew that I was sitting in Apollo Hospital and I was the senior advisor in Apollo Hospital, believe me, the number of people who called me and the type of problems that they had, I never imagined that they had these problems when I was not there in Apollo Hospital. So I could help a lot of them, contact them, make good doctors, interact with good doctors, help them out. A friend of mine, his brother fell sick. They diagnosed it as cancer in Karimnagar. I was able to bring him over within 4 hours from Karimnagar in the Apollo ambulance to Hyderabad. Ask him to go through all the tests. And by evening, could tell my friend that, hey, your brother is not having cancer. All he has is some infection in the lung. And believe me, the amount of the joy I saw in his face, I think, was one of the biggest satisfactions that I had. So you can help out. I mean, if you know and you are in some position and people know that you are there, and then they would ask you that you can help out. And it's a wonderful and a powerful tool, this networking that we can have. And I think we need to impress upon people back home the power that this type of thing can have rather than just forming these small groups. Thank you so much.